Thank you very much. Yes, so good afternoon, ladies and gentlemen. As we get started here, I would just like to mention we've had a shooting in the riding in Nanaimo today at the Western Forest Products Mill near Duke Point, and apparently 4 people injured. So I'd just like to take this opportunity to express condolences to the families and the co-workers and all the people associated with the mill at Duke Point in Nanaimo. Today, we're here to talk about Health Canada and what's wrong with the regulator. The issue, go back to 2004. I asked the question when the first articles came out in the CMA Journal relating gastric acid suppression to these deaths in the hospital. 2004 was the year we had 1,000 deaths in Montreal area hospitals. I met with the Minister of State for Public Health of the day and also spoke to the scientific director of the laboratory in Winnipeg, our National Microbiology Laboratory. A warning was posted on the Public Health Agency website, a clear warning, the clearest one that's been there in 10 years actually, with a couple of paragraphs explaining the biological plausibility and how these drugs suppressing gastric acid may well be an important risk factor with 210% increased risk. And basically, when I talked to the scientific director, the conversation went that way. I said, you're going to let these people die rather than warn them. If they're on those medications, they have a 210% increased risk of an infection that could extend their hospital stay by 3 weeks, result in an unnecessary bowel surgery, and take their life for 6 to 9%. And in Quebec in 2010-11, it was 16% of 691 people that died from this infection. After that, within a week, there was a warning posted on the Public Health Agency website. So the issue today is to do with the Drug Safety and Effectiveness Network was set up by our government. I just want to set the stage by reading the clear statement that came back from our newly established agency. And their report back, and I'm sure this wouldn't have been referred to the Drug Safety and Effectiveness Network if I hadn't persisted in asking the previous minister to do so. One paragraph, I'll just read it. Previous studies have found that use of PPIs, proton-pump inhibitors, these are gastric acid suppressing drugs, is strongly associated with an increased risk of Clostridium difficile infection. The association is present for both nosocomial, that's hospital-based, and community-acquired CDI. In studies of nosocomial CDI, an increased risk was present at both institutions with elevated CDI incidence rates as well as those with low incidence CDI rates. Furthermore, there's evidence of a dose-response relationship with the risk increasing with increasing intensity of gastric acid suppression. So, we have commonly prescribed class of drugs. We have 1,400 deaths a year still, and that's over a 10-year period. We have a strong report back from the Drug Safety and Effectiveness Network, and yet the department officials seem content to post a conflicted and weak statement on a website that somebody might look at. There are no warnings to the doctors, there are no warnings to the public, there's no communication to hospitals, and this is costing us hundreds of millions of dollars in increased lengthy hospital stays. Now, I went back to 05 when I asked the former health minister, Ujjal Dosanjh, about this issue. He said, we're going to get to the bottom of it. We are going to have the Canadian Nosocomial Infection Surveillance Program look into this. That's teaching hospitals across the country, more than 50 teaching hospitals. They'll get to the bottom of it. Well, the report was published in 2007, and amazingly, they didn't get to the bottom of it. In fact, they learned a lot about the bug, the age of the patients, the demographics of the patients, the wards they were on. They did molecular analysis, toxin analysis, and genetic analysis of the bacteria. However, somehow they failed to collect the data on the medications they were on in admission. Now, if you look at the website today, you'll find, amazingly, I tracked it all the way through from 2004. The warning, the clear warning in 04 was replaced with one line under the what puts a person at risk. Today, in the last week, they actually removed even the one sentence related to proton pump inhibitors, which I find quite astounding. the warning, in fact, should be increased. You have to look at a different place to find a warning that has confusing and conflicted language like a possible association. A definite relationship has not been established, but it hasn't been ruled out yet, implying it might be any day. And I have provided in the background material for those who want to pursue it further, the information that documents all of those changes. So the DSEN, my question really is, how is it possible? How is it possible to do a study at teaching hospitals and ignore a clear and independent risk factor? And I think that's a question could be posed to many researchers out there, and they would find a respectable journal would never publish a study that neglected a clear and confounding important issue. There are other experts who are prepared to take follow-up questions on this, and I'll refer to them later. 2 in Canada, 1 in the United States. The question is, how is that possible? And how is it possible that after a clear warning from the Drug Safety and Effectiveness Network, that Health Canada would seem to want to ignore that as well? Now, the Drug Safety and Effectiveness Network, according to their own website, was set up to inform regulators, that would be Health Canada, and policymakers, that would be the minister, and would presumably include pesky people like MPs that keep asking questions about issues like this, the policymakers and the healthcare providers, the doctors, and the public with information post-surveillance on drugs. That is a very important need today. That's why it was set up. And yet when I got a letter from the director, the executive director of DSEN, saying, having reported back clear conclusions, that they have no role beyond reporting back to the regulators. So it seems that DSEN is either confused about their mandate and unable to communicate warnings to the public or even to the policymaker, and that Health Canada is simply incapable of making clear warnings to the public, to the doctors, and to the hospitals that depend on the regulator to actually set the framework. Now, I want to say that there's no other sector where such an implausible public safety management would be tolerated. If it was cars with the wheels falling off, we have an issue today with GM and ignition issues. We have Chrysler with brake issues. And there's recalls. It's been on the national media. Everybody knows about it. Health Canada's response is like calling up an automaker, Transport Canada, calling up the auto regulator and saying, well, they've added it to the driver's manual. When they get a new car, it'll tell them to check the wheels and make sure all 4 or all 5 nuts are actually on the wheel. I don't think that would be tolerated. If it was airplanes falling out of the sky, this is the equivalent, 1,400 deaths a year, of 5 or 6 crashes each and every year. And it's like Health Canada posting a warning on the pilot's chat line, asking the boys to please stop drinking in the cockpit. We're not sure that it's related to the crashes. There's a possible association. It hasn't been ruled out yet, so would you please refrain from drinking in the cockpit. This would not be tolerated in any other sector, and so I'm asking for some answers to these questions. First of all, let me just say the health minister is not a health expert. She depends on the expertise of her department officials and the integrity of those officials. The hospitals depend on that information to make appropriate decisions. The doctors depend on it, and because Health Canada has failed in this, there's a perception that these drugs are well tolerated. They're actually causing a lot of carnage. There's an increasing list of other problems that are associated with these drugs, from calcium depletion, that after 5 years you're at risk of fractures. That's because you're developing osteoporosis. You don't absorb minerals when your acid is suppressed. There's magnesium depletion. That leads to cardiac arrhythmias, seizures, tetanic muscle contractions, and possible sudden acute heart attack where you die on the first one. There's also potassium depletion that leads to both neurological and muscle irregular functions. There's B12 deficiencies. Now, for a lot of these things, there's other medications that can manage those conditions. They might give you another drug to manage your arrhythmia that's simply caused by magnesium depletion. They might put you on drugs to manage your osteoporosis. But frankly, we should be doing something to make sure people can actually absorb the calcium in their diet. So the minister's not an expert, but the Health Canada, the hospitals, the doctors, and I think the public have a right to know that the regulator's in their corner. I'm hoping that someone will help get some answers from Health Canada. Who's in the public's corner? And, you know, they always, at the top of the list for C. difficile is elderly. Now, it was well known 30 years ago that the elderly, they don't run as fast, they don't jump as high, and neither did they produce as much acid. It's been in the literature. We've had 30 years of experimenting with suppressed acid, and I would point to Dr. Katz's article, Failing the Acid Test, in the Archives of Internal Medicine. Dr. Mitchell Katz, he's willing to take calls from media. He is he's the director of the second largest health district in the United States in Los Angeles County. It's 4 hospitals under his directorship, and he's willing to take calls. He did an editorial failing the acid test on this matter. And Eileen Burford Mason in Toronto, an immunologist, she's willing to take calls on this. The information is in the package and in the press release. And also Alan Castle's a drug policy researcher at the University of Victoria. Now, just the final point that I would make is this little package. If you were to go on the Health Canada website, you'll find all of this information about C. difficile. You'll find 15 pages about infection control in acute hospital settings. You'll find 14 pages on infection prevention, long-term care facilities, so how to scrub every nook and cranny to try and prevent these infections. You'll find 3 pages, if you can find your way through. These are the fact sheets on C. difficile. What is it? How do people get C. difficile? And there's a section down here, who's at risk? And that section, amazingly, now says, used to say proton pump inhibitors, but today it only says those at higher risk include the elderly, people with severe underlying illness, and people taking certain antibiotics, especially over a prolonged period of time, or cancer therapy. So even the one line that used to refer to proton pump inhibitors has been changed just last week. That's quite amazing to me. And you will find one page, if you look hard enough for it, proton pump inhibitors under the section called Recalls and Alerts that mention a possible association between PPIs. The studies acknowledge important limitations with regard to study design, impossibility of establishing a definite cause and effect relationship. Definite association has not been confirmed, but the possibility has not been ruled out at this time. That is in contrast to clear warning on the FDA site that mentions you have a 40 to 270% increased risk, and it's in contrast to the Drug Safety and Effectiveness Network report that just came back. So I want to know, how is it possible for Health Canada to simply ignore this in the face of all this evidence from so many sources? And it's time for the regulator to actually demonstrate that they're in the public's corner. Health Canada has other tools available to it. They could be talking with the people involved in prescribing. It's well understood these drugs are overprescribed. Estimates are from 60 to 70% of the people taking them should not be taking them. There should be tight protocols on the small number of conditions that these drugs are appropriate for: a bleeding ulcer, Zollinger-Ellison syndrome, a rare condition, Barrett's esophagus. The small number of patients who need those drugs should have them, but the 70% who are put at risk when they're taking a drug that's wreaking havoc with their health, frankly, and beginning with C. difficile deaths, you need much tighter protocols. So I'm calling on Health Canada to do its job. Frankly, we have a new bill before the House, C-17, that is called Vanessa's bill. That will give the minister much stronger powers to deal with issues like this. But in the meantime, it's simply not acceptable for Health Canada to continue to look the other way. Are there any questions?
Have you been in recent communication with Health Canada or the minister?
Yes, that's a good question. Well, I met with Health Canada officials several weeks ago now, probably a month ago, and sat across from the regulator and asked these questions. The answers are simply, in my view, unacceptable. And that is the reason that I've decided to attract some public attention to the issue. It's been going on for 10 years, 1,400 deaths a year. A lot of them were avoidable. And I don't want to understand, as I've already announced I'm not running again, I don't want to find out 10 years from now it's still going on because the regulator has refused to act.
So what were the answers that they gave you a few weeks ago when you met with the regulators?